as an example of companionship meal sharing, I used to visit a gentleman who wasn't looking after himself, wasn't eating anything, and was not preparing decent food for his meals, and he was neglecting himself. So part of my remit as his support worker was to visit him on a regular basis every week and try to encourage him to eat. Now then, I started off by offering to make his lunch. That received a firm no. When we talked about it, he said, "But you're a guest in my house and you shouldn't be making me meals." Right, okay. So he had short-term memory issues, but not dementia. So, so I had a think and came up with the idea that I would have a very important meeting that I had to go to straight after seeing him, and that I wouldn't have time to stop anywhere to grab some lunch. So I decided to come armed with a pot of soup and some freshly made bread. So I asked the gentleman, would it be okay if I ate my lunch with him just before I left so that I could go straight to this meeting? He said yes, of course. And as I was warming my soup up in the kitchen, I laid out 2 bowls and I said, "I don't think you've had lunch yet. Would you want to join me?" He said, "Oh yes, okay." So there's this gentleman who had resisted me making him lunch, but because I had phrased it in such a way that he was helping me out, we sat and shared my homemade soup together and also some homemade bread and butter, toasted. So that was a resounding success. It lasted a while, but then unfortunately he became poorly and it wasn't viable anymore. But just sitting together with somebody at a table, sharing food, sharing an eating experience, providing companionship and having a good old chatter, it was amazing what a difference there was in him. And obviously he was getting some sustenance as well. But the other thing I noticed was that I'd cut up the bread, the toast, buttered toast, into fairly small portions because he became quickly overwhelmed by lots of food on the table. I'd learnt that previously. So I'd made them very small portions, but still put them on the same plate. So I started off with taking a portion of buttered toast and dipped it in my soup. And while he was talking to me, I was eating it. He then asked me a question. So I then responded to him. And I noticed that he reached forward and took the toast and started dipping it in his soup. So so there's a certain amount of mirroring going on when you eat with somebody with dementia. They are picking up on the visual clues that you are giving them. They are also watching your body language and maybe picking up all sorts of things from you that you are totally unaware of. But they may have communication difficulties, but other things like body language and tone of voice and how you make them feel, those still resonate for quite a long time. So mirroring companionship at meal times is really, really important. And particularly as somebody's dementia worsens and they may lose some communication skills, just that simple act of eating together is extremely beneficial. I do highly recommend it. It may take you 10 minutes longer, but please do it so that they still feel part of a unit.